Hello, and welcome to another installment of Coffee and Tea with AARP. This biweekly program is an opportunity for AARP staff and volunteers to speak with experts and decision makers and ask questions about issues that impact older adults. My name is Anna Doroghazi, and I'm one of the policy directors at AARP Connecticut. Before we introduce today's special guest, it's my pleasure to introduce today's volunteer co-host, Jean Caron from Old Saybrook. Hi, Jean.
Hi, how are you?
Doing well. How are you?
Good. I'm pleased to be on this discussion today, particularly at this time of the year where we're all reviewing our options for Medicare, et cetera. I'm a volunteer with AARP for a number of years now and have done a fair amount with caregiving and advocacy, and very interested in hearing more from Ted today.
Great. Thank you so much, Jean. I'm also very pleased to introduce today's guest, Ted Doolittle. Ted is the healthcare advocate for the state of Connecticut, and in that role, he and his team work to improve healthcare access and provide free assistance to consumers who are having problems of any sort with their health coverage. He's an attorney and former federal prosecutor, and prior to his current position, he served as the deputy director of the Center for Program Integrity at Centers for Medicare and Medicaid Service. Ted, thank you so much for taking the time to join us today.
Great to be here, Anna. I'm glad to be here with AARP, and good to get the word out by the Office of the Healthcare Advocate, which I like to call the best kept secret in state government.
Great, and I have heard it referred to that as well. So I know you and your team do a great service to folks. So thank you for that, and thanks for being with us.
You're very welcome.
So to start off our conversation, Ted, I wondered if you could tell us a bit more about the Office of the Healthcare Advocate and as your role as the state healthcare advocate, exactly what does that job entail?
Sure. Well, thanks for asking, Jean. So the Office of the Healthcare Advocate in the state of Connecticut is an independent state agency. We're not part of the governor's administration. I'm the head of the agency appointed for a term of years. So that gives us some independence as opposed to the governor's regular cabinet members who can be dismissed at the governor's pleasure. So the Office of the Healthcare Advocate used to be called the Office of the Managed Care Ombudsman. It was created in 1999, and our job, as Anna alluded to earlier, is to help folks who are struggling with their health insurance. And that can be Medicare, it can be Medicaid, which we call Husky in this state, it can be a commercial insurance, it even can be some off-brand or unusual type of coverage like a healthcare sharing ministry that you get through a faith-based organization. Any way that you are funding healthcare under the statute, our case managers are authorized to assist you just the way an attorney would, except that we're not a private attorney. Our services are free of charge. We have a staff of 17 folks. That includes paralegals, attorneys, nurses, and other case managers whose main function in life is to try to help folks who are struggling with their health insurance coverage. That could be a claim denial where you've had prior authorization denied or a claim denied and you're looking to fight it. It's confusing. And if you can get to us, we can help you for free and manage that situation. We can also help with counseling you with plan selection if you've got a choice at work or otherwise, and any type of other administrative situations you're having with the health insurance, like for instance, they haven't received your check, they say you were uncovered for that month and you know you sent the check, or there's other type of billing dispute, anything having to do with your health insurance coverage, we're authorized to provide free expert assistance.
It sounds like you're a little bit of a secret, because I was just going to ask you, what are some of the frequent issues that people approach you for and how do you resolve them? Do you have maybe one that you know, that being confidential, but one that sticks in your head that was pretty important?
Yeah, well, we've had a number of, our cases range from something minor that we can handle in a coaching, what we call a coaching call, somebody who is new to health insurance, they get a bill, they think, oh, geez, I have health insurance, why did I get this bill? And it might be a deductible plan. So we have to explain that's a legitimate bill, you're going to have to pay that. And that can be resolved with just coaching them on how deductibles work and familiarizing themselves with insurance, which is one of our jobs. It get on up to folks who we've had clients for years with families who have a family member with a chronic condition, requires expensive medical equipment at home. They run into periodic denials or other complicated issues that can drag on for years. So it can really range the gamut. Our bread and butter is, just to grab one recently out of the air, we had a 18-year-old woman who was living away from home. She was on her parents' health insurance. She had back pain. She had to go into the hospital after failing a number of medications and other therapies. So she was admitted overnight, for a couple of days. She was admitted. She had a CAT scan that showed she might have some blood in her spinal column that could be causing this back pain. Very unusual situation, but they decided to keep her overnight. Well, and properly so. Now that was denied. And the young lady was distraught in tears when she came to us. She owed $53,000, didn't know what to do. We were able to take over that case, take the load off of her, allow her to focus on getting well. And the final upshot in that case was one of our nurses was able to get that entire service covered.
Oh, great story.
Yeah, and I'm sure a relief for folks who just need someone who's not in that state of panic to walk them through the process. And I think it's always helpful when lawyers and nurses step up to lend a hand in these cases. So one reason why I'm really excited that we're speaking with you when we are is that we're in the middle of Medicare open enrollment. Which is a thing that I don't think is fun for a lot of people. I recently came across a survey in which older adults said that reviewing their Medicare plan is one of the most unpleasant tasks that they undertake in any given year. People say they hate it more than renewing their driver's license, but they hate it a little bit less than colonoscopies and trips to the dentist. So not very popular, but is there any advice or guidance that you have for people who are looking at their options and trying to decide what to do during open enrollment? Are there factors, I think there are some of the ones that are obvious to folks like cost and network and drug formularies, but beyond that, what should people be taking into consideration when they select their plans this year?
We're talking specifically about the Medicare plans. At this point, obviously, well, maybe not obviously, but there's two flavors of Medicare. There's Medicare, what I'll call traditional, and then there's private Medicare offered through companies like United Healthcare and others. That's called Medicare Advantage. They both are supposed to and do cover the same benefit package, but they're administered a little bit differently. They're both administered by private companies, but the traditional Medicare is delivered directly under the auspices of CMS, the Centers for Medicare and Medicaid Services, Medicare, what people call Medicare. Whereas on the other hand, the Medicare Advantage plans are branded and administered by any number of major health insurance companies, be it Anthem, Connecticut, Aetna, whoever it might be. And that's just much more like having a traditional employer plan. You're limited to the network usually. That's one great consideration, Anna, the great dividing line between the traditional Medicare, which I tend toward recommending, and the private Medicare. The private Medicare have limited networks. So especially if you're traveling to visit loved ones or you travel periodically to get some sunshine in Florida or elsewhere, you have to be really careful if you're going with the Medicare Advantage plans, which are financially attractive, but sometimes you wind up finding out that you get what you pay for in terms of not having the travel network. So that is one consideration people have to keep in mind, is whether they're going to be local to Connecticut, in which case a Medicare Advantage plan can make more sense. It's not always the right choice, but it can make more sense, whereas somebody who moves around might be more attracted to the nationwide traditional Medicare.
I might add that I know people don't look forward to reviewing it annually, but I just did and found a marked difference last year in my Part D drug plan. And so it's really important that I make the change. My husband has glaucoma, and the drops that he uses are extraordinarily expensive. And we saw such a big difference in both of the plans. So I really encourage people to consider that every year. I'm one of those people, task lists. So I know when October 15th is here, I need to go check this out, and I will do it again tomorrow. But you know, we kind of put some of these things aside, but in the long run, it can wind up saving you a lot of money. So it's important to do.
The Office of the Healthcare Advocate can help navigate folks there for free, obviously. Though, of course, the really good resource that people need to know about is Choices. Those are the plans throughout Connecticut that people need to be aware of. And those people specialize in helping you navigate and choose between Medicare. Our office here is all types of health insurance. We're generalists in that sense. The Choices folks are the people to reach out to for Medicare enrollment and getting the nuances between your different plan options so you can decide what's best for you and your family.
Great. So for folks who are not yet Medicare eligible, do some of these considerations also apply when you're selecting commercial plans?
Yeah, absolutely. In terms of, first off, you might not have a choice. I mean, if your employer, if you or your spouse are employed by a company, they offer one plan, that's going to be your choice. If you're lucky enough to have a wider range, you need to be taking into account things such as, do I have dependents on my plan who are not living in state? You know, perhaps there's a child under 26 who's on your plan. They might be out on their own, but they're on your plan. You might want to make sure they've got the network doctors that they're going to need in their out-of-state realm. So yeah, the considerations are definitely similar. As I say, sometimes in our country, you get what you get, and that's it. But when you do have a choice, you need to look not just at the premium and the deductible, which people generally understand and know how to navigate, but also the network and the doctor selection. And Jean was mentioning as well the medications. The drugs can be different that are covered in if your employer offers a Cigna plan and an Aetna plan, let's say, the drugs could be different. So you need to look at what's called the formulary, which is the list of drugs that particular plan covers, which varies from plan to plan.
Mm-hmm.
So one question that I had, and this is actually based on a conversation that I overheard in the last week, but as more and more folks delay retirement and might continue to have employer-based health insurance beyond age 65 when they become age eligible for Medicare, what does that mean for folks? What do they need to know about the interaction between their employer-based health coverage and Medicare? I know there are penalties for late enrollment. But if you're still covered by employer-based health insurance, are there penalties that apply? How do people need to navigate that?
Well, first thing is to ask, and that means ask your employer and ask your Choices. Even if you're still working, the Choices resource that I referenced can help you navigate that. You need to remember that as you approach 65, and most, not all, but most of the folks on Medicare age into it when they're 65, that they're eligible. And so your question is great. If I'm still working, what do I do? Well, first off, don't delay learning what your options are. You can sign up for Medicare even when you're still on your work plan. But you don't have to. And that's I think the heart of your question. If you are on a plan, you can wait to sign up for Medicare until you or your spouse, whoever's got the coverage, stop working. But again, I would counsel being proactive and as you approach 65, go and find out what your options are and get a plan in place, and perhaps even sign up for Medicare, even though it's not going to be your primary insurance while you're still under your work plan. Again, you are allowed to sign up for Medicare preemptively. You're just not required to if you have what's called qualified coverage, which most employer plans are going to qualify as coverage to allow you to delay signing on to Medicare without a penalty.
Okay, but like, as you said, probably good to check in with your employer just in case they have one of those exceptional sorts of plans that might not.
Yes, absolutely. If you're self-employed, for instance, that's a wrinkle. The rules can be a little bit different there. If you're on a health insurance plan through your work, you might think you're covered under what we're talking about. You don't have to sign up. But if health insurance is not available to everybody at your workplace, it might not qualify. So again, it could be there's banana peels all over the place. So your best move is to ask. Another complication is if what your coverage is COBRA, that creates a couple of different rules as well. If you're on a small plan, less than 20, again, I don't want to get into all the details here, but just want our listeners to know, if there's a small plan less than 20, I might have some complications there. Again, ask, go to choices, go to your employer, come to us if needed. Another thing that some folks might want to know is if you're contributing to an HSA, you actually have to stop contributing 6 months before you go on Medicare, or else you suffer a tax consequence. So point is that it's complicated. There are resources, the chief one being the choices resource in our state, and people need to ask. Don't assume you're fine. Find out whether you're fine.
I would totally agree with the choices program. It's terrific, and people should be aware of it and seek advice sooner rather than later.
Yep.
So AARP's done a lot of work on trying to protect older adults from all kinds of fraud, and especially Medicare at this time of the year. Before your time as the state healthcare advocate, you spent a significant part of your career protecting government programs, the Medicare and Medicare fraud. So could you tell us a little bit about that work and what sorts of things are scammers doing? We know some of them, but we look forward to hearing what you have to say and what the government can do to stop it.
Sure. Yeah. No, I have a long career on in healthcare, but that includes program integrity or anti-fraud work, both with the Connecticut Attorney General's office and, as you mentioned, with CMS, Medicare. A couple things to say about that. First off, there is the Medicare Senior Patrol. That's a group of volunteer folks across the country who have their antennas up about fraud and do education in their communities. And that's a terrific program that really has caught a lot of fraud. The little known part about the ACA, or the Affordable Care Act, there's a whole anti-fraud component to it. It's a big bill, went beyond just setting up the exchanges, and it had a whole anti-fraud component. And that's why I went to Medicare. I was the first deputy director of the Center for Program Integrity there. And it was an exciting time starting in 2010, because it really brought the anti-fraud work in Medicare up into the modern age, the new generation. We set up what's called a predictive analytics system, Jean, where on a real-time basis, as the millions of claims are streaming through the system every day, the computers watch that and pick out little bits of information about particular claims, but also about particular providers. And then that information is run against algorithms, analytics to detect fraud. For instance, an algorithm might be, is a female patient being charged for a prostate procedure, something like that, or is somebody that is somebody having a third leg amputated. Also, things that can't possibly be right, and then an investigator would follow up on that. Those are some crude examples, but that's the nature of it. And the fraud prevention system cost quite a fair amount of money to set up, and a lot of time was spent on it, but it's really running quite well and has brought, I think, really, Medicare had a reputation of being a patsy for fraud. And I think the fraud prevention system has kind of leapfrogged in some respects. My private insurance industry colleagues won't want me to say this, but I think that Medicare is really doing very well in terms of anti-fraud. There's still lots of fraud out there. I also do want people to understand that fraud is not the overriding contributor to our incredibly internationally abnormal high prices. It's a problem, but it's a problem in all the nations. And it certainly is not the way we're going to beat back our high cost problem. I just want people to know that Medicare, to the extent it has financial problems, those problems aren't due to fraud. They're due to the high price of medical care, which is an entirely separate discussion to have.
Thank you. Well, I think we're getting near the end. Anna, anything else to add?
I'm trying really hard not to jump down the rabbit hole here and talk about the need for Medicare to negotiate prescription drug prices, which is a long-standing AARP policy priority. Maybe we can put a link.
Supported by the Office of the Healthcare Advocate, 100% supported.
Wonderful. Hopefully by the time this airs, we'll be in a better state federally, but
And I'd like to just make one comment too. We talked about the difference, Ted, thank you, between traditional Medicare and Medicare Advantage. And I can tell you, I am so barraged with phone calls from insurance providers, from mail, from email, from text, for me to sign up for Medicare Advantage. So I hope people listen to this piece, especially what you had to say, where you really described the difference, which could really be helpful as people look to sign up first time for Medicare, or if they're looking to review the current program that they're in. Thank you for that.
Absolutely.
This has been great. Do you have anything else you'd like to give us guidance on, or comments that you have?
No, I think we've covered a lot. It's a complicated decision. I would urge folks to really invest time as they approach 65, and then every year, Eugene did the right thing of doing the unpleasant task of trying to learn about what your best options are, because it can change from year to year.
Well, thank you so much to AARP Connecticut volunteer Jean Caron, and thank you to Ted Doolittle, the state healthcare advocate for the state of Connecticut. And thanks to everybody who tuned in to be with us for this week's installment of Coffee and Tea with AARP. You can find new episodes on our Facebook page every other Thursday morning at 9 a.m. And you can find all of our episodes of Coffee and Tea on our YouTube page, youtube.com/AARPCT. Jean and Ted, thank you again so much. We really appreciate having both of you with us today.
Thank you.
Thanks so much.